And it goes a little something like.
Hi, good day. I'm Nurse Kristel and I am your nurse for today. So today we will assist our patient with the use of cane, crutches, and walker. And for the assessment of the client, always ask first two identifiers with your clients. You can ask him or her about his or her name and age. For the procedural guidelines of using these assessive devices, number 1, record your patient's recent activity experience and also record his weight also. Review also your patient's medical record about history or risk for orthostatic hypotension. Also review the healthcare provider's order for activity and don't forget the mobility and weight-bearing restrictions. Determine also the best time to ambulate your patient and schedule around other activities. Check for your patient's environment for barriers or any safety risk. And don't forget to wash your hands or do the proper hand hygiene, and after doing that, assess your patient's readiness to ambulate by assessing his or her baseline vitals, the ROM or the range of motion, and muscle strength in lower extremities in bed if necessary. And after that, ask your patient if he or she experiencing tired or any pain. Determine the source and severity of pain and administer analgesic if necessary. Don't forget also to assess your patient's level of response to command, views regarding health, and willingness to participate in activity. And lastly, assess also your patient for any deficit that may affect his or her ability to follow instructions. And of course, don't forget to have chair or wheelchair nearby if necessary. Determine patient or caregiver's understanding of type of device being used. And lastly, of course, don't forget to assess degree of assistance patient needs with physical therapist input. For expected outcome, I need to ambulate myself, yes myself, to use those assessive devices carefully with having proper body mechanics and proper gaits. Explain also to your patient how to prepare for this activity and what are the benefits of this activity. Consider also your patient level of education and beliefs regarding recovery. Explain and demonstrate the specific gait technique to patient or to the caregiver. And also don't forget to check the appropriate height or fit of cane, crutches, and walker. And of course, ensure that your ambulation device has rubber tips. And of course, before applying the procedure, don't forget to wash your hands, and assume that I already washed my hands so that I can sanitize myself using this alcohol. And then you can also sanitize the ambulation devices for safety purposes. After do the hand hygiene, always ask your patient to report any tingling or numbness in upper torso. The first assessive device that we will going to use is the cane. We have the improvised cane here, and then first, help the patient to walk with the use of cane. Make sure your patient hold the top of the cane beside the stronger leg. And for the proper fit of the cane, make sure the foot of your patient must match at least 4 inches away from the tip of the cane, and then the elbow are bended into 15 to 30 degrees angle, and then make sure the wrist crest of your patient must level at the top of the cane. Assume that the level of the cane is properly fit to me. Instruct your patient to place the cane appropriately forward to keep his or her weight on both sides. Instruct also your patient that when you forward the cane, make sure to advance also the weak side of his or her foot. The weak side of the foot and the cane are matched appropriately, and then followed with the strong foot. Let's try to walk. Assume that this is the weak side of my leg and then this is the strong side. Okay? Move your cane and your weak side of your leg forward, followed by the strong side. crutches and we will help our patient to walk by using the appropriate crutch gait. Instruct your patient to use the 4-point gait. By the use of these crutches, begin with tripod position. Place the crutch tips in front of the foot and make sure that your patient's weight is on hand grips. Move right crutch, followed by the left foot, left crutch, and then followed by the right foot. And then repeat above sequence. Secondly, instruct our patient to use the 3-point gait. Begin with tripod position. Advance both crutches in affected leg. Move the strong leg forward, stepping on foot. Repeat sequence. Next, instruct our patient to use the 2-point gait. Begin with tripod position. Move the left crutch and your right foot. And then next, move the right crutch and your left foot. And repeat the sequence. Instruct your patient to use the swing 2 gait. Begin with tripod position. Move crutches forward. Lift and swing the leg to crutch and let the crutch support your body weight. Instruct the patient to use the swing through gait. Begin with tripod position. Move both crutches forward. Lift and swing the leg through and beyond the crutches. Help the patient to climb using these crutches. Begin in tripod position. Transfer patient's body weight to crutches and position patient with handrail on side of strong leg. Support weight evenly between crutch and handrail. Place some weight on crutches and step up with strong leg. Allow patient to regain balance. Assume that this is the weak side of my leg and straight up the strong side of your leg and then lift your body weight up into the stairs. Repeat the sequence and observe your patient's level of balance and fatigue. And also consider your patient's ascent stairs from a seated position if necessary, moving crutches upstairs as he or she goes. And lastly, help our patient to descend stairs using these crutches. Begin in tripod position and transfer your patient's body weight, and your patient must hold the crutches along with the strong side of his or her leg. Bend your strong knee. Move crutch, involve the leg down step. Support Support your patient's weight evenly in both sides of crutches and ensure that your patient has good balance. Broad involve leg down to step. Caution patient not to hop. Consider also your patient descends stair in sitting position if necessary, moving crutches down as he or she goes. And lastly, help the patient ambulate with the use of walker. The first thing that the patient must do is to stand straight in the center of the walker and then hold the hand grips. By the holding of the hand grips, make sure that the elbows are bended into 15 to 30 degrees angle, like this. And then for the position of the foot, make sure the back tips of the walker are matched into the middle foot of the patient. The next thing that the patient must do is to move the walker forward and then forward the weak side of the foot followed by the strong side of the foot. Okay, 1, 2, 3, go. Move the wheelchair, move the weak foot, followed by the strong foot. Move. And then the nurse must instruct the patient not to advance past front of the walker. Also, the patient must be instructed on how to be advanced if weakness is present. And lastly, the patient must be instructed not to climb unless the walker is designed for these steps. And lastly, don't forget to assist your patient for his or her comfortable position in bed or in chair. For example, in this walker, if the patient wants to sit down in the chair, the patient must at least forward the weak foot and then hold the grip, and then after that, hold the armrest and then slowly bend the strong feet and then sit down like this. And then if they want to go with a comfortable position, move the wheelchair, the walker, the cane, and the crutches side and then sit down. After all the procedures that you do to your patient using those assist devices, don't forget to wash your hands and do the proper hand hygiene, and assume that I already washed my hands so that I will apply the alcohol, and if you have the hand sanitizer, you can use it to sanitize your hands. And after it, don't forget to ask your patient to report the numbness or any dizziness in upper torso. And for the evaluation, monitor your patient's vital signs as always, and then observe the skin color of your patient, and don't forget to ask your patient's level of comfort and energy. And next, evaluate your patient's subjective statement regarding to his or her experiences. And for the gait of your patient, observe his or her body alignment in position and balance. And lastly, for the unexpected outcome, I do the proper body mechanics and the gaits using those assistive devices, and I don't feel anything pain. And of course, don't forget to record all the pertinent informations in the appropriate log and document evaluation of patient learning. And lastly, of course, report any injury sustained, alteration in vital signs, and of course, lastly, inability to ambulate to healthcare providers. So, thank you!